안녕하세요. 미국 간호사 써니입니다. 오늘은 제가 리포트 종이를 작성하는 방법을 여러분과 공유하려고 해요. 이게 벌써 두 번째 영상이에요. 한국에서는 다 전산으로 리포트를 받아서 딱히 리포트 종이를 작성을 안 한다고 들었는데 미국에서는 리포트를 컴퓨터 스크린을 보면서 받기도 하지만 대부분 그러면서도 종이에 다 일일이 적어요. 저는 받아 적으면서 외워지는 편이라서 그게 딱히 불편하지는 않았어요. 리포트 종이 형식도 병원마다, 병동마다 다 다른데요. 저도 이것저것 다 써봤는데 오늘 제가 보여드리는 방식이 저한테는 제일 편하고 맞아서 이렇게 써요. 여러분도 이것저것 다 해보시면서 자신한테 제일 맞는 방식을 찾으시면 돼요. 시작하기 전에 오늘 들려드리는 환자는 허구의 인물임을 알려드리고요. 제 이전 영상 영어로 리포트 주기 두 번째 영상에서 다른 환자분의 내용을 똑같이 따왔으니까 좀 더 자세한 설명이 필요하신 분들은 그 영상을 참고해 주세요. 링크는 위에 달아 놓을게요. 자, 그럼 바로 시작할게요. We have Mr. Stephen Woods, 40 years old, male. Patient of neurosurgery. He's a full code and he's allergic to sulfa. Wife's name is Nicole and her number is in his chart. He has his cell phone in the room, so they have been talking to each other. He has a past medical history of hypertension, current everyday smoker, smokes about 1 pack per day, vasectomy, and he was diagnosed with arachnoid cyst back in March of this year. So, back in March, he experienced sudden nausea, vomiting, headache, and dizziness. He went to urgent care and CT of his head showed an arachnoid cyst that was compressing on his cranial nerves 7 and 8. They tried to manage the symptoms medically to avoid surgery with steroids and antiemetic. They seemed to work for him, so they tried to taper off or wean off, and symptoms came back unfortunately. So they consulted neurosurgery, and on the 20th of April, he got a scheduled craniotomy with cystectomy and nerve decompression. During the case, he was stable and transferred to our unit for observation. He was stable overnight. Today, his morning repeat CT was stable and we started him on a diet. Physical therapy and occupational therapy evaluated him. Plan is to keep him another night for observation and to transfer tomorrow to the floor if he remains stable. Neuro-wise, he's alert and oriented ×3 and Perla. When he first came back from surgery yesterday, he had pretty significant nystagmus and dizziness, but it has gotten so much better. He still complains about some dizziness and nausea when he opens his eyes and is experiencing some photosensitivity, but overall, he has improved so much. He walked around the unit with PT with a walker and a gait belt. He has been up in the chair since lunchtime and has been tolerating it just fine. Cardiac-wise, his rhythm has been normal sinus with no ectopies, and his blood pressure has been stable anywhere between 120s to 150s. His parameter is to keep systolic under 165. He has PRN labetalol and hydralazine if he needed. His pulses are strong on the uppers and lowers, and he does not have any edema. His heart tone is normal, and his cap refill is within 3 seconds. Respiratory-wise, he's on room air when he's awake, but he needs about 2 liters of nasal cannula when he goes to sleep. I think he has an undiagnosed obstructive sleep apnea. Lung sounds are clear over diminished. Tmax for me was 99.8 orally. GI-GU-wise, his abdomen is soft, round, non-tender, has good bowel sounds, and his last bowel movement was on the day of his surgery. He is on a regular diet and has been eating about 50 to 75 of his tray. ACH's blood sugar has been normal. He voids in the urinal and has had adequate urine output. Skin-wise, his incision is on his right side and it is covered with some dressings that neurosurgery applied. We do not have an order to change it yet, and the dressing has been clean, dry, and intact. He also has some pin sites from surgery. They are all open to air and looks good. His bottom and sacrum looks good and he has a Meplex on. For pain, he can have 10 of Percocet every 4 hours. He has been taking it about every 5 hour-ish. If he gets nauseous, he can have some Zofran every 8 hours as needed. I gave him once a bit after he walked with PT. He has an 18 gauge on his left hand and it is saline locked. Lab-wise, his white count was 11 this morning, but it has improved from 15 the day before. Everything else was unremarkable. That is it. Any questions or concerns? 자, 여러분, 오늘 영상은 여기까지예요. 여러분들도 연습 꼭 해보세요. 계속 연습하시다 보면 어느새 익숙해져 있을 거예요. 다시 말씀드리지만 제가 이렇게 하는 방식만이 정답은 아니니까 여러분들이 계속 연습하시면서 자신한테 맞는 방법을 찾으시면 돼요. 오늘 영상이 도움이 되셨다면 구독과 좋아요, 알림 설정까지 꼭 눌러주시고요. 저는 다음 영상으로 돌아올게요. 오늘 하루도 건강하시고 화이팅 하세요. 감사합니다.